Now we bring you a report on one of the top 10 issues of 2014, Ebola. We had the pleasure of speaking with Dr. Jamesha, a local doctor who went to Africa to help those infected with the deadly virus.
Hi, my name is Jamesha. I am here to interview you about Ebola. And the first question I want to ask you is, when did you first hear about Ebola?
I heard about Ebola in 1976 when they had the first outbreak in Zaire.
Have you ever found another virus that was stronger than Ebola?
Well, I don't believe there's been another virus that has gotten the attention that Ebola has gotten. There are other viruses that are similar to Ebola in the hemorrhagic fevers and that class of viruses. And the one thing that makes Ebola get so much attention is that so little is known about it, and the incidence of morbidity with it. So many people die when they have it. Since the initial outbreak in 1976, they've only had, I believe, about less than 3,000 confirmed cases of Ebola in the world up until this present outbreak in Western Africa. I don't have very much apprehension about the presence of Ebola in the United States because of the situation and the difference in the situation in the United States and in the other countries where they've had outbreaks with Ebola virus. What causes the Ebola to be such a disaster and reach epidemic proportions is not the virus, but the inability of the healthcare and infrastructure to manage the disease. So in the United States, they have a very well organized public health system, and they know how to respond. They have the personnel, the staff that are properly trained, and they have the equipment and supplies to provide the treatment, and they have the infrastructure, the hospitals and the laboratories that are needed in order to go out and take care of the population.
And did you ever work with kids?
Yes, I'm a pediatrician. So I worked with children for many years in my own private practice, and I work with children quite frequently when I go on humanitarian medical missions. And I think the one young person that comes to mind when we talk about working with kids is, well, I'll say his name, William is his first name. I won't say the rest of it. But there were very few survivors in the Ebola treatment unit, and he survived Ebola. And I felt very confident. I was very involved in his care and treatment.
Well, thank you for participating in this interview. I had a great time with you.
Thank you.
My first reaction to the Ebola outbreak in West Africa would be concern. Firstly, for the people and families of those that are infected with the disease in West Africa, and for people around the nation or around the world that could, contract the disease simply by somebody getting on an airplane or walking out of a nation, making physical contact with somebody else and spreading the disease, and then it could spread just as easily as that person going home, hugging their wife, kids, and it can grow at an exponential rate. My second reaction would be shock, simply because this disease is relatively new, and it is growing at an exponential rate. Already thousands of people are infected in West Africa, and that is also something that concerns me, because if it keeps growing at the rate it's growing now, there will be a full-blown epidemic on our hands. My third reaction would be worry and hopefulness that World Disease Control Centers are able to contain this disease and come up with a cure, hopefully in the near future, so that less people will die and we can keep this disease controlled and contained within the parameters that it is now in West Africa.
Over 6,202 people have died from the Ebola virus in West Africa, while 4 cases have been confirmed in the United States, with 2 deaths.